Good evening, everyone, and welcome to the Health and Wellbeing Scrutiny Committee on the 9th of July 2025. Can I welcome our guests for this evening, our AD Jo Sands and Sonia from the ICB. Just a reminder to the members that the meeting is being recorded and will be uploaded to YouTube. First item on the agenda is apologies for absence. I've received apologies from Councillor Claymore, Councillor Doyle, Councillor Hadley, and due to a change in political balance, Councillor Wadrup is no longer serving on this committee. Have we got any other apologies? No? Brilliant. Item 2 is minutes of the previous meeting. The previous meeting was held on the 21st of May 2025. Can I request a mover for the accuracy? Brilliant. Seconder? Thanks. All those in favour? Brilliant. These ones, isn't it?
Yes.
Item number 3, declarations of interest. Has anybody got any interests that need to be declared? Fab. Item number 4, update from chair. I don't really have any updates from the last meeting. To be honest with you, I couldn't go to the last Staffordshire County Council Health Overcare Board meeting, Scrutiny Committee. It's got a very long name. I couldn't attend as I was unwell, so I don't have anything to bring to the committee on that.
That should be under here. That's my fault.
Don't worry, it's fine. Don't worry. Moving on to item 5, responses to reports of Health and Wellbeing Scrutiny Committee. We haven't got any updates to share on this. Agenda item number 6, considerations of matters referred to the Health and Wellbeing Scrutiny Committee from Cabinet or Council. We haven't got anything under this item. Agenda item number 7, updates related to matters considered by Staffordshire County Council. I've kind of already preempted this. As I said, I wasn't available to attend, but the most recent meeting was on the 30th of June, and the recording's available online if anybody wants to give it a watch. They discussed the changes in maternity services, which might be worth having a look at, especially with the changes being presented at Lichfield, might impact some of our residents. So I don't really have anything else to share on that. We have invited our County Council representative, Councillor Luca. However, we haven't received any apologies, acknowledgement. So I'd like to think that he will attend at some point, and I'll be sure to reach out to him myself personally to make sure he's had the invite and that he can start to attend these meetings. Okay.
Apologies. He's at the Marmion House. He's just messaged me.
Apologies, Councillor Luca is at Marmion House, so hopefully he will be with us. I retract my previous comments. Leanne will be organising him to be with us very shortly. Do you want to pause before we go on to item number 8? Just so he's here for that. apologies for that. So just want to clarify that Councillor Daniels, portfolio holder, is present now, and also Councillor Luca has joined us as well from Staffordshire County Council. Thank you for taking the time to come. We really appreciate it. So I'm just going to go back to agenda item number 7, update on health-related matters considered by Staffordshire County Council. I stated previously before we paused the meeting that I was unwell, so I wasn't able to attend the meeting on the 30th of June. I was at the one before that, though, when we were going through the work plan, and I came back to the committee and said that it was a really worthwhile thing to be a part of. So I've made it my priority to make sure I can be there as much as I can, and I'm sure that Paul will want to go to a couple as well. Sorry, Councillor Turner, the Vice Chair. Is there any updates that you'd like to share with the committee on any kind of health matters related to Tamworth? If you want to speak, it's just you press the little speak button on the mic in front of you.
Hey, obviously I had a meeting with the NHS because what they're planning to do with the savings, and we've got them coming back to work because we've raised some issues. And I did ask about the George Eliot unit because they've been reinvesting into a lot of mental health, and unfortunately that is a non-starter. They've put that completely off. They're also looking at possibly getting rid of the midwifery maternity side at the Lichfield County, and I believe there was another county hospital that they're believing on getting rid of the midwifery and maternity side there and trying to amalgamate it into one bigger unit. And again, we've raised concerns about that. I mean, and the other thing I can tell you at the minute, unfortunately I can't tell you too much, that I did raise that they're looking at actually cutting costs on how and where they buy their drugs and who supplies them to them. And I did raise concerns regarding that, how are they going to be acquired, and what basically protections they're going to put in place to make sure that they're not buying counterfeit, because there has on numerous occasions where the NHS has actually ended up buying counterfeit drugs.
Can I just ask for clarity on, so obviously the NHS is kind of, it's huge, there's lots of different elements of the NHS. When we're talking about, you mentioned kind of cuts to drug distribution, what part of the NHS specifically? Is this a trust, is it?
Basically, it's all the Staffordshire NHS trusts have to find a saving, and this is not us, this is government, of 306 million. So what they're saying is it's going to affect around about 800 jobs, but they're refusing to call it cuts. They're saying that they're trying to actually make sure that it works more efficiently.
Is this the cuts to the ICB? So this is, do you want to come in, Sonia? Sorry, Sonia's from the ICB. Sorry.
If I'm right.
PNC, Sonia. I'm so
PCN,
sorry.
Yeah. So I'm Sonia. I'm the operations manager for Mercy and PCN. So I work with the 9 GP practices here in Tamworth. I wasn't obviously at the meeting, but I can envisage that discussion was probably about the cuts that are coming with the changes to the Integrated Care Board and the amalgamation of the Integrated Care Board. But equally also, I think with regard to the drugs, I think that's probably related to hospital drugs, if I'm right. So the drug tariffs that we pay for hospital drugs, I would imagine.
Yeah, I just think when we're talking about cuts, obviously members of the public are watching. I think the NHS is so large and it's so kind of multi-layered. I think we just need to be careful making sure we're being specific, because that can just create paranoia if we're just saying the NHS across Staffordshire. But yeah, the ICB, we spoke about it in the previous meeting, because the ICB came to the first county meeting that I went to. And obviously they've got to make significant cuts within one financial year. So I have spoke to Leanne about putting that on our work plan, and looking at how those cuts are going to directly impact Tamworth. So it's on the committee's radar. So we'd appreciate you bringing anything that you can around those, and those insights are really helpful. So thank you. Was there anything else that you wanted to add?
Yeah, you ask about invites. I've got no problems. Anybody, I'm quite happy to invite anybody that wants to come along and see how we operate on one of the meetings. The only other thing I will say is they have actually invested in new services. Actually, it's Sir Robert Peel, but I did actually mention how technically that isn't in Tamworth.
So I can kind of expand on that, so I know a fair bit about it. So it's a community diagnostic centre at the Robert Peel, which is fantastic, and it might not be in Tamworth, but it's used by Tamworth residents. So I understand your point, but it's the hospital that's used by Tamworth residents, and those services will benefit Tamworth. So I don't know whether the location's a moot point, in my opinion, personally. It's a fantastic thing, and I think the official opening hasn't happened yet. We're still waiting for the date of that. I think it was rearranged, but do you want to come in? Yeah, if you could.
I'm speaking on behalf of the NHS here, which is a bit scary for them, I'm sure. So over at Sir Robert Peel, they've got the Community Diagnostic Centre. It is open, but they've also got, so that's for blood tests and for local testing centres, which is really beneficial for our patients because they don't no longer have to go to Burton to have those done. So for us and for our patients, it's really, really good. The second part of it is the Urgent Treatment Centre. Yeah, and that is the one that hasn't been officially opened yet. So there's those two elements, and we're anticipating, I know they've had to go through quite a process to get approval for Urgent Treatment Centre, various assessment processes they've had to go through. So I think that is imminent, probably by autumn, I would suggest. But that actually increases the amount of services that are being delivered from Robert Peel, which is really, really good from our perspective.
Yeah, one thing I will add as well is they are looking at developing services in the community to cover a large range of mental health illnesses. And from what I've actually seen, that if they can implement this, it's actually going to be really good for Tamworth residents. So I will actually give them praise for that one, because like it says, you're going to find it a lot easier to find support at all levels of mental health once it's integrated into the system.
Yeah, it'd be great to have an update on that once you've got more information, and feel free to bring it to the committee. I know that mental health support is a big kind of issue in Tamworth, and we do already have some fantastic facilities that do great work, lots of charities, lots of organisations, but the more help the better. We know how many people suffer with mental health, and yeah, really welcome an update on that. So I'll move on to agenda item number 8. So update on health inequalities, work and local I can't say this word. That's it. Improvement framework. So the LFI funding. So can I just say thank you to the Assistant Director Jo Sands for joining us this evening, and Sonia from the PCN. Yes, I've got it right. Apologies. Sonia is from the PCN, and we've also got the portfolio holder, Councillor Daniels, here as well. So I will hand over to Jo for the report.
Thank you, councillors. The reason that we feel this is something that should be on the health and wellbeing scrutiny radar is, number one, it's a very successful project that's coming to Tamworth as a pilot, working across partnerships around the locality improvement framework. The locality improvement framework is a funding pot that's come available through the Staffordshire ICB. £100,000 per locality. There's very strict criteria on how it was bidded for and what data was looked at. There's a few recommendations for the committee in the report, but I did the overarching report to explain the sort of context of this. And the lead partner on this project will be the Primary Care Network. Sonia is an integral member of our Health and Wellbeing Partnership that's up and running as a thematic group of the strategic partnership. So I will, Sonia is very, very done a sort of presentation for us, so I'll let Sonia take you through the slides for all that. Thank you.
Okay. Thank you very much for welcoming me, by the way, and for allowing me the opportunity to do this. So, as Jo's already said, we have, as part of the Health and Wellbeing Partnership Board, we were offered the opportunity to bid for this locality improvement framework money. We have gone through a detailed process looking at a range of data, and that the group has consisted of everyone on that health and wellbeing partnership, and then we've created a separate strategy group and a steering group for this particular funding. So just to give you a bit of a background, the project itself that we've identified to deliver and that we've won the funding for is around targeting obesity and the associated long-term conditions of diabetes, cardiovascular disease and hypertension in Glasgow, Stonydelph and Belgrave, particularly focusing on the most deprived area of Glasgow Heath. So in terms of the locality improvement framework, there was a very detailed stringent criteria that we had to follow, and that was in ensuring that we involved as many partners within the local area as we possibly could. So that has involved the Borough Council, the County Council, the primary care network and GP practices as part of that, Support Staffordshire, MPFT, so that's Midlands, excuse me, Midlands Partnership Foundation Trust, your community provider in health, and a range of organisations from the voluntary sector and our overarching of Support Staffordshire. So the £100,000 that we have managed to secure is for year one. There is also possible funding for years 2 and 3, depending on how successful we are with this project. So the aims are to tackle and reduce local health inequality and improve health outcomes, supporting lifestyle and behavioural changes of people in the community, strengthening our local networking and partnership organisation work, and ensuring that a substantial part of that funding goes towards the voluntary and community sector organisations to support our work. So what we actually looked at, there's something you may all be aware of that's called population health management data. Now, as councils and health, we all look at data on a regular basis, but very rarely do we actually look at a range of data together that's come into one place. What's interesting is the accumulation of that data has meant that we've been able to identify a range of things, and that's why we've identified those particular areas of obesity, diabetes, cardiovascular disease and hypertension as having significant effect on the health of Tamworth residents. So not only, unfortunately, are we 4th in England as far as our obesity prevalence is concerned, we are one of the highest for children aged under 11 for being overweight at that point. Our most deprived areas, Glasgow Heath, Stonydelph and Belgrave. There are others, but actually for this purposes of this project, it meant that there was a grouping quite close together of an area that we could focus on. Looking at hypertension, cardiovascular disease, diabetes and depression and mental health as issues that affect people's ability to live healthy lifestyles. And we also looked at data from primary care and secondary care, so that's hospitals and GPs, that those long-term conditions are also significantly affect emergency hospital admissions from patients in this area. So what that group agreed to focus on, we wanted to both support an individual cohort of patients so that we could actually follow them and see their success, hopefully, with intervention of the project, and how we could make a difference to them and their families. We wanted to focus on lifestyle and behavioural changes to make this project sustainable, but also engaging for those people who don't currently engage necessarily with other services and with GP services. And we also wanted to look at some prevention activity within the project, so looking for supporting children and young people with healthy eating, healthy lifestyle, to try and engage them early on. So the actual project that we've come up with, it has 3 elements. We will be having a community wellness worker based and embedded in Heathview Medical Practice, which is Righton Caledonian in Glasgow Heath. We're looking at an individually identified patient cohort of about 40 people who were identified. They don't very often come to the GP practice, so that's an interesting element in itself. But they also have some form of long-term condition, and they are on our obese registers. We'll be working with them and their household. So the idea is we take a household approach, not just the individual. The idea is we will look at identifying and removing barriers to what their well-being and co-working with our other local providers very, very closely. And we want to see an increase in the use of health monitoring services, so blood pressure, weight monitoring, weight loss, those elements. The second part is that we want to create a range of activities for lifestyle and behavioural change to instigate that into the community and embed it into the community through a range of providers, and to create some links to sustain those changes and encourage those changes. That might be incentives of some way, with, like you have your free passes to do the county gym, the local gym, the one in the castle grounds.
Yeah, community hub.
Community hub,
Yeah.
that's the one. But we also want to make sure that we're co-producing those activities with patients, because we want, and residents, because we don't want those to fail. So we want to make sure that they are activities they actually want to do, not necessarily what we think they ought to do. And the third part is about that prevention programme, and we are looking at holding 2 early years or schools programmes with schools in Glasgow Heath, or early years programmes in Glasgow Heath, and holding a community event, at least one, to try and engage the entire community. So we held our first delivery group meeting today, and we've already set about starting to look at the recruitment, to look at the grant giving to the voluntary and community sector, to support elements of council work that's already been done with Active Tamworth, and starting to plan our delivery programme. Okay. If anybody has any questions.
Sorry, Councillor Clark.
Thank you, Chair. I was just wondering about stakeholders in the situation. Obviously, the Borough Council is. When I see an obese child, I think exercise, football pitches, but we won't go any further on that in Stone it off. But that's the sort of thing that we could do fairly simply, isn't it? Providing sort of the wherewithal for the people that you're dealing with to improve their lot. Is that sort of a simple, acceptable thing we could do?
Yeah, absolutely. That's part of what we're aiming to do, is to use what we have locally to ensure that people are encouraged and engaged to go and use those activities, and that those activities happen in places where they feel comfortable, and that we've got, I think, one of the amazing things about Tamworth, I've only worked in Tamworth for the last year, but I don't live very far away, so it's very, very close to my heart. But I think the interesting part of this work has been that the amount of stuff that is in Tamworth to be able to use, it's just making sure that we work together to use it. So that's why the stakeholders and the engagement of all the partners within the delivery group is really important. So it ranges through children and families, the family hub over at Glasgow Heath, the active wellbeing group, part of the Borough Council. Jo and her team have been absolutely fantastic in getting this and pulling this together. And the other part of it is that the clear delineation to the health and wellbeing partnership and being part of the strategic partnership means that it's very well linked throughout the whole of Tamworth's plan and strategic plan.
Yeah, just as well, I think when people say £100,000, it's not a lot of money in the scheme of things for that 1 year. And obviously, it was a decision that the ICB wanted a very targeted cohort. It wasn't something that they said want to put on event for the whole of Tamworth, or so that's why, using that data, we've gone down to the targeted level. And yes, we soon saw that those levels of unhealthy, maybe it could be unhealthy eating, but it's also different causations. It's poverty as well. That working on that whole family approach with that cohort, that can be then scaled up as we, and if we can prove the concept. And as I said, this is a pilot scheme that the ICB have done of using this locality infrastructure framework. We are the guinea pigs. We are the first district to have actually jumped in the water and worked together to do it, because we've had that infrastructure. So they're very closely watching what we're doing to hopefully scale that up over the next couple of years and maybe into the future. And I think that's testament to the partnership working here.
I think one thing that I haven't presented and was actually quite significant, and the reason why we've gone for the cohort, is because it's actually, you can see the potential for saving us costs in the health sector and in the community by implementing some of this work. So I think I can't remember the £2,500 per patient per year. For these, so it came out as like something huge, 5 million for 40 people over their lifetime. Yeah, it's a lot. So so £100,000 is a drop in the ocean in comparison. But if we can help and we can put people on a better course, on a better life course, then that's the overall aim.
We've got any other questions, Councillor Luca?
Yeah, actually being a type 2 diabetic, this is something which obviously really interests me and is close to my heart. And what you're saying is 100% correct. But I can say, I won't mention the surgery that I use, but the system that they've already got in place, which I'll speak to you offline about, really good. The plan they got, I see my diabetic nurse every 2 to 3 weeks, and always up making sure he takes my weight. She never ever criticises, and that's one thing I will put. If you're going to put the information out there, don't try and stigmatise someone, because it will only push them away from the project, and obviously that's not what we want.
That's actually one of the key things we were talking about and considering, about how we go about this is about engaging people who might not currently be engaged with their issues around health and healthy lifestyle, healthy eating, and exercise. They're quite simple messages, but what we don't want to do is to stigmatise anybody. We don't want to make people feel that they are failing. It's actually about encouraging them, but on their terms as well, so working with them. Thank you, though.
First of all, thank you for coming and presenting. I think it's... Oh, sorry. No, Councillor Daniels, come in before I go on my ramble.
Sweet. I was lucky enough to be on this committee before joining the Cabinet, and I remember data being presented to all of us about these particular areas of Tamworth. For a long time this has been known. Councillors who've been doing the job a lot longer than I had said, yes, this area, so what are we going to do? Now it feels like we can, so really looking forward to see what we can achieve.
Thanks, Councillor Daniels. So it's brilliant. I kind of second what Councillor Daniels has said. It's great that we've got this funding. As this is scrutiny, I have some questions. I'm very sorry. So obviously we've spoken about the data that's been used to select the 38 patients. Obviously, I think it's great that you're extending it to the family, because actually you're getting more bang for your buck then. You're going to reach a lot wider than your aim. So that's really good that that's in the scope. But as someone who's very touchy-feely, and I'm very, when I kind of analyse things, I look 50% data, 50% kind of human. What on-the-ground conversations or work has been done to establish who these people are? Are they the right fit? Because sometimes data only tells one side of the story.
That's a really interesting question. I think the initial cohort of 38 is identified through data, and it's a mix of GP data, because we hold a lot. As primary care, we do hold a lot of data, and mixing that with some of the secondary care data in terms of the hospital admissions and the amount of money that perhaps being used by the Community Trust, Midlands Partnership Foundation Trust, to support those people. What we have done, however, is we're very aware of that. So the first piece of work for the community wellness worker is actually to go out and talk to those families and those households. We do have a second cohort, larger cohort, which means that if those particular families and households it's not suitable for them for whatever reason that might be, or only certain families. We're not expecting realistically 100% engagement. If we get 100% engagement, I'll eat my hat. But actually having that second cohort equally means that we've got a fallback position and plan B. I think the other very important thing to say was that this is about looking at how a piece of work with a small community can then be escalated. But we did want to make sure that there's community backup, and that's the reason for the wider events and activities as well. I don't want to see people feeling that this is only being done unto them. This isn't what that's about, and we were very, very clear within the steering group about that. Does that answer your question?
Absolutely.
Okay.
Perfect. Yeah. I have no concerns whatsoever now. That is exactly, yeah, it's perfect. And then just a couple of other things. So you've mentioned, you've kind of preempted my question. Obviously, you've spoken about engaging with other partners that are already supporting people. You said about grant funding. Will that be going to those groups that are supporting with the project? Yeah.
It'll be, so we've got some money going, so the way it breaks down, the wellness worker will be based with the GP practice, and within that money there's also some time directly for clinical time, so additional doctor and nurse time to be allocated to that project, so that's really important from their perspective. Because if you're working with a cohort of identified people, you want to make sure that clinical support is easy to get to and isn't lost. So that's one part of the funding. The second part of the funding is about the activities and events and the grant funding. So out of the 100k for the first year, there's 40,000 which is allocated to that. At least 10 of which, more likely to be 30, will go towards the voluntary and community sector. And then some will also go to our partners in the council. Then we have the third pot of money around engagement events, which also includes an element of training on how to work with socially isolated communities. It also talks about those two events or engagement events with primary schools and early years settings and the community events. So it's actually split down quite significantly, but we wanted to make sure that the largest portion actually goes to the community.
Brilliant, great. And then just a couple more things from me and I will be quiet. Where was I at? So obviously this is a pilot, so this might be hard to answer, but what assessment has been made that this is value for money? Because obviously it's public money. We always want to know that it's value for money. I think rolling the dice with 100 grand is a bit of a risk if we've not established that.
Yeah, that is the 100 million question. Yes, what through Karen in my team and Sonia did, they had to present this to the ICB board, so that it has been presented to. It is, again, they've took that leap of faith. Because the idea on the health inequality is that it becomes prevention, education, health, the things that prevent people actually getting into the NHS system itself where possible. So the first evaluation will be at the end of this year. Obviously we've only now got 7 months to in effect to deliver the first year, but that will be assessed through the ICB. And they have already said that we are likely to get the next 2 years, so we will be presenting at the end of this financial year the progress to date. That will give some engagement, to the IT. But absolutely, from what we were talking about, more than happy to provide some local scrutiny through the Health and Wellbeing Board here to understand that we are as a council working with the ICB and the primary care network for the health. We don't directly do health, but obviously working with the partners. More than happy to come back February, March time to give an overview of how we are, and also to give an update of what the ICB are actually saying, how they think it's progressing.
Yeah, that'd be really helpful.
Obviously, it is the NHS money that we're using.
That takes me on to my final question, I believe. Sorry. So I think a lot of people in health will agree prevention is better than cause. Obviously, we've just seen the 10-year NHS plan come out this week. We've heard the Health Secretary talking about weight loss injections, Manjaro. I've got family who are on Manjaro privately. I've got friends who are on Manjaro privately. It's £120 a month. I'm not saying that that's affordable, but it's definitely not as expensive as I think people would assume it is. I'm going to be really blunt. Do you think this is a waste of time if the government are telling people, oh, you're going to get Manjaro injections on the NHS? Sorry to be blunt, but do we think this is a waste of time and money?
Yeah. This is my view on the situation. So, yes, there's been a lot about Manjaro, and yes, it will become available. However, I think the very important thing is at the moment, Manjaro isn't widely available through GP practices. Equally, Manjaro, the importance of Manjaro is that it comes with a wraparound service. Just taking having a Manjaro injection is not the golden solution, and this is my personal view, but it is one that is backed up with information. So from an investment point of view, investment in Manjaro, yes, that's one angle. However, if you don't invest in those wraparound services like this, potentially, and ensuring that people have a better view of healthy lifestyles and well-being, the prevention angle isn't going to be there. And within the NHS 10-year plan, we are talking about moving from treatment to prevention. Not moving from, but having a bigger focus, because you still get treatment, promise. But the prevention angle is very key in this 10-year plan. You know, it's like the move from hospital to community. I think this project is an example of how we can potentially pull our resources together. So as Joe says, the Borough Council doesn't cover health, in inverted commas, but you cover so many other elements that impact on health. And I don't think, from my personal perspective, we shouldn't underestimate that. So having a weight loss jab or drug or whatever it might be is one part of the solution. It's not the whole. And I think that the other side of it is we don't know what the effects are of Manjaro, and it's not going to be successful for absolutely everybody. I think, again, like all drugs. So I hope that's a...
No, I was playing devil's advocate because I agree. Watching people close to me on the drug, they're getting it online, they're not getting the support. I've got a friend who's eating probably half a meal a day, not advised on what vitamins to take. You know, it's really dangerous. I'm not shy about it. I'm going through a weight loss phase at the moment, but I've done that through a coach, and I'm doing it properly. I don't believe that an injection is the answer to a healthy lifestyle, because you're not fueling your body, but it's not for everybody. But then it's not just that, it's also there's people with medical conditions such as thyroid conditions, they won't be eligible, and there's a variety of health conditions. So I stand with you on that. I was just playing devil's advocate because I know there will be people at some point who say that's a waste of money, go and have an injection. But I agree, it's not the answer. Paul, did you want to come in with anything?
Yeah, thanks, Chair. Yeah, thanks for that. It's good that we're, holistically looking at it, really. The thing that I'd like to question, really, you've said that you're going to put 30 grand into the voluntary sector to deliver. How's that going to be structured? Because it's okay doing the voluntary sector, but volunteers are great. But how do you manage volunteers?
That's a very good question. So what we're looking at is delivering a grant scheme through Support Staffordshire, who have a very good relationship with a variety of voluntary community sector organisations across Tamworth. The idea is that we have some set criteria about what they might want to deliver. It's then up to those organisations to manage their volunteers, to come up with the activities and events that they might want to do, hopefully in conjunction with the people that they work with alongside. And I think one very good positive element of the voluntary sector is that they do that on a regular basis. That's their survival. They have to engage with their local communities, with the people that they serve very regularly. So in terms of managing volunteers, that would be up to those voluntary organisations.
But on the bigger picture, that if you look at, we give the volunteers some cash to do whatever, and we set the bar, how do we know that that's going to achieve what we want it to achieve, hit the targets? If it doesn't, how do you then micromanage, not macromanage, the volunteers? Because it's very difficult that you're saying you're a volunteer, you don't get paid, you don't, just we hope that you're going to do this. Now, this is a great initiative, but I think, are we resting too much on the volunteer sector to get it up and running? That's my question. Now, I know people are shaking their heads and they'll always say no, but it is critical. It is critical to ask these questions right now, because it's public money that we're giving to volunteers that generally you can't say you will do, you hope they will. And I think to mitigate that risk, are we doing it the right way? I'm not saying there's another way, but I do feel that giving volunteers, this is very important to get people better and cure and whatever, but is the voluntary sector the vehicle?
Yeah, that is it's a good question and to ask, and it's one of the things that most public sector organisations mull over a lot about the voluntary sector, who in Tamworth who are exceptional, without a shadow of a doubt. And obviously when we are looking at giving grants to the voluntary sector, they are fully they have a grant agreement with specific things that they need to deliver, and that's the element that they get grant funding on. What we have got to remember is that the voluntary sector aren't all volunteers. They do have paid staff, they do have paid management, who are then the experts in how they are managing their businesses. We've already got good examples of working with the NHS in Tamworth. CTCIC actually managed the social prescribing through GPs. So yes, anything that is done, Support Staffordshire as the leading membership organisation will be that one that know their organisations, and we will have set criteria for grants. And you're right, yes, volunteering is a risk, and until we understand the projects that they're actually going to be putting in money for, and what we're looking at to look at the project overall, and whether we need then, like we've got with the cohort, a plan B, is another matter. But I would at this point suggest that we have sufficient interest and sufficient infrastructure in Tamworth, which is one of the reasons the ICB, I think, have trusted us to have a look at this as a pilot, to start looking at this and doing it in a way that's sustainable. There are other projects that we're looking at outside with other funding around sustainability of our VCSE, and that's not got off the ground yet, which is a different project I'm looking at, but I would suggest at the moment we need to, obviously that will be monitored and looked at.
Just on that, so obviously you've spoken about grant funding that's given to charities in Tamworth and volunteer sectors. At some point, I don't know whether it fits into this committee, or whether you can have a conversation offline about this. I'd like to see the procurement process of how that is working, because it's all well and good as saying that we trust these volunteer groups, we're giving them the grants, they're delivering. What are the KPIs? Where are we checking in with these groups after we've given this grant funding? And if so, where is that going to? Is it coming back to committee? Where is it being scrutinised? Who is scrutinising their delivery? Because if we're giving them public money, and if we're not scrutinising them at a committee level, I'd like to suggest that if we are agreeing to give grant money to volunteer sectors in Tamworth, I would like to see it at this committee that I'm not saying we approve that funding, I'm not saying that's within our gift, but I'd like to see what is expected, what you are outlining as an authority to them, what their KPIs are, and if they're meeting it or not. Because if they're not meeting them, then why are we giving them the money? So yeah,
absolutely. There's no question on that one. As far as the locality improvement framework delivery group is concerned, it establishes the criteria for how they can apply. It also will expect reports on what they've what they've done, and the impacts from the engagement that they've had with those people in the community. So we would be looking at that, and that is part of the grant giving process, is to report back, so that actually their activity forms such a large part of this project that that's what's really important from our perspective as well. If something isn't being delivered, or if an event's been funded and it hasn't happened, then we would expect that money in return to be returned, for example.
Carrying on from what obviously the council has just said, and this is obviously a pilot scheme. For the auditing, what procedures have you got in place? Are you actually physically going to go out and make sure that they're spending the money where you're actually saying they're going to spend the money?
Yeah, that is the, I mean, any grant money that we just give as a borough council is monitored very strictly, either quarterly meetings usually, or sometimes monthly with the organisations that have grants. And as Sonia said, they will and do have KPIs. So any money that's given through my team and Sonia and the rest of the board, the Health and Wellbeing Partnership will be the board that oversees this project. We will be expecting to see what is being delivered, so that, not just for this committee but for the ICB, we can actually report on the outcomes. So undoubtedly any money that's ever given will always have a grant agreement, which has got very set terms and sort of deadlines, and also has all the KPIs that group is expected to cover. So yes, we cover it, and then that will then again be audited, and every year, although this grant money will not come through us, any grant money that we have externally, any grant money that we give as a borough council, is subject to the transparency and is reported on through our transparency agenda. So at any time, any grants that are given, certainly through Tamworth Borough Council, and any grants that we've been given through external funding appear on that transparency register. But more than happy, councillors state them, to use this scrutiny committee to scrutinise what's going on with this report. Within other reports that I've brought previously, for instance, the performance of our Tamworth Advice Centre, the performance of other grants, more than happy if you want to have that oversight of any grants that are given. I'm very happy to get the team to come.
Yeah, it'd be really great if we could see KPIs, what's expected, what the targets are, what we're aiming for. If we can maybe get that in some sort of, I know you guys do fabulous kind of tables, so maybe if we could have one of those colourful tables, Joe, sorry to add to your workload, but I think if the committee could have that, that would be fantastic.
With from an officer point of view, if you could give us, give us a time scale of how often you'd want that, and from our own workload, I think it would be easier if we could do that a little bit later on and towards the end of the year.
Absolutely, no, it's when you're ready. There's no rush. If we can try and get some sort of, I don't know whether it's email round to members, maybe like a month before the meeting or prior to the meeting, so we know what we're going to be scrutinising. But that'd be great.
If we can take this offline, and then obviously we can have that discussion.
Absolutely.
About what you'd like. And
then in terms,
put that on your forward plan later.
Yeah. So in terms of the procurement process, specifically with grants, I don't know whether that sits under this committee. Me and Leanne were just having that conversation, whether that needs to go to audit and governance.
I suppose it depends which element we can ask for. If you want to look at the process for, I suppose it depends. Like I was just saying, though, that this isn't our funding, so we couldn't for this funding.
So I think from a point of view of these grants, okay, yes, it's not a project that's ICB funding. It's similar to the community recovery grant. It's not money that's come through Tamworth Borough Council. So therefore, it's something that would probably be directly impacting health and well-being.
Yeah.
So from a point of view of debate, that's probably where it sits rather than our own audit governance, and we need to check that with the monitoring officer. But I would suggest that where that sits.
Of course. And then Councillor Pallett will come in afterwards.
Yeah, I think the ICB have got a very robust process as well in terms, and because it's their money that's coming down through the project, their auditing and their scrutiny will be equally very, very detailed. So that's why part of the project, as the first one's going through it, we have been offered by the ICB some additional assessment and evaluation. So they will be doing that on our behalf. So I think the kinds of reports that we would be producing for them will probably be able to match the requirements that you're talking about as well.
Councillor Pallett, did you want to come in?
This is probably a stupid question.
It's a good question. There it is.
If or when this 12 months and it's proved successful, and we're doing really well in Glasgow and Stony Delph area, in the second year and the third year, will it then move into different areas of Tamworth, or will it just carry on in those 3 areas?
I think that's probably up for debate, depending on how successful we are, and how the delivery team, as a group of organisations, feels that might best be grown, as it were. So I think it's open at the moment. We could be looking at different cohorts within that area. We could be looking at a different area. I think after this first year, we'll be able to assess whether it's actually worked for that area and for the smaller cohort, and then we can see how we develop it further. But I wouldn't want to say exactly how that might be, because there's so many organisations involved, and we want to make sure that the evaluation happens. Is that okay? Mm-hmm.
Yes.
No. Oh, no, it's not a no.
No, and I think it also depends again on that criteria that the NHS and the ICB have set, because they're very clear on the locality infrastructure network that it takes the core 20, which is on the indices of deprivation, that they understand the health inequality. They are trying to address health inequalities and understand that the most vulnerable in our communities have the biggest health inequalities. So therefore, when we move forward with it, I guess it would be a same data analysis as to where it's expanded to or goes further against that core 20 plus the 5 health issues that are the highest health issues for the community. So they probably wouldn't rule it out, but they'd obviously have to do that based on data and the population, because the idea being that they want to improve health inequalities to those most vulnerable.
Sorry, we're just talking about what we can and can't do. Councillor Luca, did you want to come in? Sorry, just for context, in this committee we put our hands up and then it works a bit different at county. But
Okay, not a problem. I'll remember that for next time. Just going back to your plan, it's just one thing I'm thinking of. How are you going to change people's eating habits? How are you going to move that up through the plan?
Personally, I'm not. I think the key thing about the engagement is having that wellness worker. So the different elements of the project. So the wellness worker will work with a range of people who know about diet, know about healthy lifestyles, know about healthy eating, and the idea is to engage individually with those households. So it's not about, one of the key things we didn't want to do was to say you've got to come to the GP practice, you've got to come here, you've got to come there. It's about outreach, so going out into their homes, so home visits, encouraging people to engage, but us going to them, not them coming to us. So that's number one. The raft of information that we have around healthy eating and previous projects where it's been successful. So we'll be looking at various things that have both been active here in Tamworth and in other areas about how that's worked and what messages work, what doesn't work, and equally thinking about the wider issues such as, are they struggling with poverty? Are there issues with their housing that make it much more difficult for them to have a healthy lifestyle and to have healthy eating? In terms of the work with the children and young people, we've had various schemes already that have operated in Tamworth and across Staffordshire. I think the food, food factory.
Yeah, the
Food Factory, the Family Hub in Glasgow Heath have actually run some different courses as well. So it's actually taking advantage of the information that we know and that the NHS diet plans, the weight management system, the diabetes team. There's a raft of things out there. It's just trying to pull them together and put them in a way which, again, doesn't stigmatise but actually works with individual households.
And I think, say, using that partnership network, so if it is about that health in the first instance, but if that health worker and the other teams that are involved can actually signpost to other services, so if it is a core cause of finance or, that we can actually signpost to the relevant organisations. So, you're right, you can't, I think my father always used to say you can take a horse to water, and obviously it will be personal choice at the end of that day, as to how or they wish to engage. But hopefully with that coaxing, that realisation, it's not a stigma, that it's a genuine attempt to help them live longer and more healthy lives.
Better.
Yeah.
Thank you. Has anyone got any other questions, or Councillor Clark?
Thank you, Chair. I'm really heartened, frankly, from listening tonight. I mean, I'm a Stonydale councillor, and I know that Belgrave and Glasgow are the other two that we suffer somewhat, or our residents do. But the wraparound security we have, I mean, we have no, at the moment, financial direct budgetary concerns here as a council, but we can do a great deal to push this on. And Support Staffordshire, they are a very good umbrella organisation, and also every volunteer group that is in Support Staffordshire, I know several of them, they're all well constituted, which means they have rules, they have safeguarding, they have financial rules and so on, just like you would expect. So there is a reasonable safeguard, but Support Staffordshire are a second layer of support and protection from us. And I think the fact that it's been done locally, specifically locally, bush telegraph is a wonderful thing, whereas sticking pieces of paper through people's doors doesn't work, does it always? Because there's always a bin nearby, isn't there? I think that trying to advertise it in a localised way is going to be one of the ways forward that individuals like ourselves can assist with. But I'm also keen that people realise Tamworth is part of Staffordshire. County Councillor Luca, because we have often felt that Tamworth being at the bottom of Staffordshire doesn't matter to you. In the same way that Staffordshire Moorlands, right at the top, feels exactly the same. So I'm glad that you're here, and I can tell you this, and you can make sure that we never feel like that again, please. But I am heartened that we've already started, that there are little buds of growth already, and some of our organisations, they are small diamonds, but they do a lot. I mean, in Belgrave, we're teaching people how to grow their own food. In two of our schools in my area, we've got a forest school where they're learning how to plant. And if you can, tell a 4-year-old how to plant something, they'll remember when they're 14, won't they? So I'm pleased, and I like the way the starting gate has been opened in a small way, but I'd like to see you continue. Thank you.
Thank you, Councillor Clark. Can I just second what Councillor Clark's just said? Councillor Luca, it's fantastic to have you here. I sat on this committee last year as a member, and I don't think we had a county representative once. So it is fantastic to see someone here contributing, committed, and I look forward to seeing you at county meetings in the future.
Can I actually just add, I might actually have a northern accent, but I was actually born in Tamworth. I mean, I'm actually a Hockley lad. I mean, and what I can actually say is all of your representatives in the county council all live in their divisions that they represent in Tamworth. And for Belgrave, I actually live in the old original village. So obviously I know a lot of what goes on in Belgrave. I do stay in contact with Claire, which is the community support officer. I've got, I don't know if you know Belgrave that well, but I mean, I do go out and make sure that I involve myself with local businesses. I try to find out issues. One issue that I've just sorted out was the temporary fence that was up at St Gabriel's for nearly 3 years. I mean, and once I talked to Highways, we came up with a solution. And it wasn't about fixing the wall, it was about opening the pathway again so the children didn't have to walk down the road to get to school. So anything Tamworth, I mean, all I can say is approach her, because we are very much Tamworth people.
Thank you for that, and I agree completely. I've had a few interactions with your colleagues, and everyone seems to be bright-eyed, bushy-tailed, really raring to go. Everyone that's been elected. I've had really positive interactions with the Tamworth new county councillors. So thank you for kind of the way you've approached it. And like I said, really, really great to have you on the committee. Have we got any other questions on this report, or can I move to the recommendations? Did you want to sum up, Joe, or are you happy? Did you want to sum up, Sonia?
So if everybody's, and the reason we wanted to bring it to here is because we wanted to make sure that there was some oversight and ownership, not just with us as a partnership in the ICB, that it came through the sort of council. You're right, as Councillor Clark so succinctly put it, you need to be aware of that. You need to be aware of what's going on so you can be the advocates for these projects. So I'm more than happy to take questions. We can feed it back through the Health and Wellbeing Partnership group at any time, and we'll do so, continue to do so, and obviously come back.
Great,
When
brilliant.
I've got time to write
I'll
another
hold you to that, Joe.
report.
Don't worry, you know I will. The recommendations are that we consider and endorse the approach to the development of the Staffordshire and Stoke-on-Trent Integrated Care System Locality Improvement Framework, or the LFI pilot funding for Tamworth, presented by Mercy and PCN, and support the strategic involvement with the Staffordshire Health Inequalities Strategy through the Health and Wellbeing Partnership. Can I ask for a mover? Councillor Turner, seconder. Councillor Clark, all those in favour? Carried unanimously. Brilliant. Thank you both for coming so much. You are free to leave. You're welcome to stay for the remainder of the meeting if you'd like. Otherwise, go and enjoy the sunshine.
I'm happy to stay if you want me to, around anything you want to discuss on the forward plan, or otherwise.
You can stay if you want to. I think we're just going to go over a couple of bits on the work plan, but most of it's work in progress at the moment. So you're welcome to go and enjoy the sunshine. Same with you, Councillor Daniels. You are free to leave.
Go and do my singing.
Absolutely. Thank you so much. Lovely to meet you. Great. So that brings us to agenda number 9, working group updates. So we currently don't have any working groups on the committee. However, I did say to Leanne, I'll briefly do an overview of what the work that I've been doing, which kind of feeds into the community partnership, which Joe heads up at the council. Pat's attended one of the meetings, and so has Councillor Clark. So I've established a Women's Voices focus group here in Tamworth. We've been working with Tamworth Police and the community partnership, which is made up of a variety of organisations, council, police, voluntary sector. And in 2 weeks' time, we will be presenting an official bid for a campaign later on this year. This meeting is open to everyone to attend, male, female, any gender identity. It's not just for women, this meeting. We need to get as many people on board as possible to support. So that's kind of a side project that I've been doing. It's not specifically a working group, but it fits into the theme of wellbeing in the community. So if you haven't had a calendar invite, and Councillor Luca, you're more than welcome to come along as well, and any of your colleagues as well. Obviously it's Tamworth, so I know that they'll want to be involved. So if you haven't had an invite and you want to attend, just let me know after the meeting. Is there any working groups that anyone's really keen to get up and started, or are we happy to just review as we go along for now? Review as we go along, brilliant. So agenda item number 10, forward plan. The forward plan has been circulated prior to the meeting. Is there any items that they'd want to see on the forward plan sorry, let me rephrase that. Are there any items from the forward plan that they'd like to see on the work plan? No? Brilliant. Okay. You can go through the plans anytime. Leanne regularly circulates them, so, and I think you can find them on on ModGov or the website. So if anyone wants to have a look and has any ideas, bring them to the next meeting. Agenda item number 11 is the work plan. So the work plan has been attached to the agenda. However, it's a work in progress at the moment. There's a couple of items that Joe has gone away and is looking at, because I specifically raised family services as an area that we wanted to look at in Tamworth. We don't really seem to have that core hub of family services in Tamworth. I call it the bread and butter of health services that you kind of saw, I know scrutiny is unpolitical, but you kind of saw under the 97 government, that kind of, back to basics healthcare. So, for example, I had a case referred to me from the MP that, for context, I work for the MP, probably should have declared before I said that, that was to do with a lack of breastfeeding services. So there's not really kind of any support around that. So Joe said that the county is looking into something to do with this. I don't have any specifics, but she said that it will be brought back to the committee on the work plan at some point. I've had a few submissions for the work plan on the scoping forms. If anyone wants to submit anything, there's still time, isn't there, Leanne?
Well, yeah, if we get any, because we've got a couple of things on the next meeting, so any forms we get, we'll bring to the next meeting to then get on the plan for future.
Yeah. So I know we've only got a handful of meetings in the diary. I have requested that this will be more than what is there. 4 meetings is not enough, I don't think. So there will be, in my opinion, at least 2 or 3 more throughout the year. And we've just spoken about, obviously, the procurement process and following up on kind of grants and things, specifically with the voluntary sector. Me and Leanne have just checked the Constitution. I say me, I mean Leanne. It does sit under us to scrutinise the voluntary sector. So I'm going to submit a form submission for the work plan that we look at how the voluntary sector in Tamworth is monitored and their performance is measured against the funding that they get, because I feel that there's a lack of scrutiny around that, and I feel like there has been for a while. So I'm very pleased that that is within our scope and not audit and governance. So that will be submitted and we'll see that on the work plan. And on social cohesion, so obviously this is a wide piece of work that's going on. I have spoken with Joe and Leanne, and I've stated that I want this to come back as many times as possible. There's a lot on there in terms of the funding. So just for context, we've obviously had £600,000 from the government of Community Recovery Fund. This was given to all of the communities by the government who were affected by the riots that we saw last year. So I'd like to see, again, the KPIs of every single thing that they have used this money for. What are the intended outcomes? How are we going to measure if this has improved social cohesion in Tamworth? So Joe's aware that I'll be on her about that. So we have already got it coming up in September, but I've asked to see it again before the end of the year, and I think I might ask to see it in the middle as well at some point. So if there's anything that you want to be discussed, if you just fill in the scoping forms, Leanna, were you all right to circulate that? Just a reminder. Yeah, we'll send another scoping form around so everyone's got a copy. And the next meeting will be on the 23rd of September, where we will be receiving the biannual safeguarding update, and we'll go through the Building Better Communities, Community Cohesion and Engagement Strategy. So in short, the social cohesion. That's it really from me on the work plan, unless anyone's got anything they wanted to raise at all. No? Well, that brings us to the end of the meeting. Can I thank, again, Councillor Luca for coming, his attendance, his contribution. It's invaluable to have someone from the county in the room with us. It really bridges that connection between us and county.
Long overdue.
Long overdue, absolutely. As we said, it's been years. Has it been years, probably? It's been a long, long time since someone has been here from the county, and it's refreshing and reassuring. Yeah, across the board. So really, really fantastic. You're welcome to come in.
Like I said, it's an honour actually to be here, and you'll get sick of my face, because I will actually There will be times where I do have other meetings because I'm on 9 different committees at the moment.
Ooh.
So there will be times where I won't be able to come, but obviously I will send you a message. But every time I am available, I'm more than happy to come along because obviously this affects me as well, being a person from Tamworth.
Brilliant.
And I just want to give you as much support as available.
No, thank you for that. We really appreciate it.
Just out of clarity, do you get a copy of these minutes? Or would you like a copy?
I can send them.
Yeah,
right
Leanne
across,
can
yeah.
get you a
I
copy.
think that being so you've started this process, it would be wise for us.
Yeah.
Sorry to
They're on
No,
the- yeah.
no, don't worry, Paul.
to
Absolutely.
make sure that you are communicate, or we communicate effectively, and you bounce it back.
Yeah.
And
I
So-
don't know if I sent the agenda or not, I can't recall, but I'll make sure that you do the next
We'll
time.
make sure that you get the agenda and the minutes and anything else that you require. Just let me or Leanne know. I'm sure we'll be able to sort it out. But if there's nothing else, any other business from anyone?
yeah, and likewise with that, if you see something on our work plan
hold on.
coming, you may want to say, I need to, you know.
I haven't forgot you. I can see you. I can see you, Margaret. Margaret, did you want to come in? Mike. Say that again, Margaret.
Sorry, Chair. Yours was still on, I beg your pardon. Can we, be as reciprocal as possible? Because we, as I say, we do feel part of the county, and if our experiment, if you want to call it that, goes well, and we can expand on it, who's, perhaps not one size fits all, but it might, and then you could be a really good staying partner, and we could make Staffordshire as a whole a lot healthier than it is at the moment. I know that your health is one of the mainstays of what your responsibility is, and we're a small part of it with our area. So reciprocity, Chair, I would think is useful.
Absolutely, and like I said, I'll be coming to as many of those county meetings that I can, and obviously Paul will come as well when he can. They're really useful to have lots of different people in the room from different backgrounds, different political parties. It's, really worthwhile, so.
Well, just to give you a bit of actually where I can actually help, the committees I'm actually on. Obviously, I'm on the health and care for the county. I'm also vice chair for the education, safeguarding and scrutiny vice chair. Yeah, so I'm also on the fire, police and crime panel. So obviously I will be dealing a lot with issues in Staffordshire and Tamworth, and I'm more than happy to make this a two-way street, and anything which I hear, which I think that yous, would benefit from, I'm quite happy to inform yous.
Absolutely, and if there's any updates in terms of health or anything that you want to bring to us, if you just let me and Leanne know, we'll make sure that it gets put on the agenda as an item, as an update. But if that's everything, I'll close the meeting at 17. Sorry, it's not 17. 7:16. Thank you for everyone that joined watching online, and I'll see you all in September. Thank you.